California's health exchange is mulling over whether to endorse President Obama's plan to extend canceled health insurance policies for 1 million people in the state. Joining me to talk about that plan are Linda Keller, Executive Vice President of Intercare, and health insurance broker David White. Linda, consumers across the country are up in arms over their existing policies being canceled because they don't meet the standard under the new health care law. Give me some examples of what these existing policies lack.
Yes, so existing policies today don't have what is called essential health benefits. So as part of healthcare reform, there's a requirement that all policies offered under Covered California or the individual plans effective January 1 must have the 10 essential health benefits. And these include things like hospitalizations, ambulatory services, rehabilitative services, things like that. But they also include things like maternity care or pediatric services. And you might have a plan today that has annual limits or doesn't cover maternity or things like that. And going forward, effective January 1, those things must be covered in the plans.
And David, we also hear a lot that consumers whose policies are being canceled, when they go on the exchange to buy a policy, that they're getting a rate hike. How big of a problem is this?
The younger you are, the bigger the rate hike. So it's a major problem. I've been talking with a lot of my clients, and I have some of my clients that say they're not 26 anymore, so they can't be on their parents' plan, so they have to pay for it themselves. They've gotten 100 to 150% increases. The good thing is, on the other side, for once, the older people have been treated nicely, and older people have pre-existing conditions can probably get insurance for much less. So that there is benefits, but what's happened is we've really raised the price on the young a lot, and that's really a concern.
And so there's an interim remedy. President Obama is proposing that states extend existing policies for up to a year. But there seems to be a divide among California officials over whether this is wise. The state's insurance commissioner says the policies should be reinstated. Covered California says they'll come to a decision by the week's end, but they say having a risk pool is critical to the ongoing viability and that the out-of-state viability of exchanges. Elaborate more on this disagreement.
Yes, so one of the things you have to remember is that if the state says we are going to allow you to continue to have these old policies, that doesn't mean that the insurance carriers have to do it, right? So they'll go back to the carriers and say, you may allow the policy still, and the carriers will have to make a decision. But remember that when Covered California and the carriers priced the policies going forward, they were looking at the entire risk pool. They were basically saying everybody who's under an individual policy today is going to move over to these policies. We know that because these policies are all going to be canceled. In addition to these, we also have people who didn't get coverage before, that because they had pre-existing conditions or for whatever reason didn't get the coverage before, that are going to come into that risk pool. We know that that group that's moving in is probably a less healthy group. To David's point, if you had some healthcare issue and you needed to get coverage before but you couldn't, you're now going to be able to get it, which is a good thing. If the decision is made where they can keep the old policies, the people who will keep the old policies are more likely to be the younger, healthier population. So what you have is those folks staying on their old policies, and the people who are on the Covered California, the new policies, will be the older, maybe unhealthier population, and all these folks who came into the pool because they weren't able to get coverage before.
So if it's extended, then you have an upset in the balance.
Absolutely. This is a poor risk in this pool now, which is going to drive, that's not how they priced it, and it's going to drive up rates in the future.
But David, at the same time, President Obama promised folks that, look, if you like your current health care plans, you get to keep them. So there's a problem with not extending these existing policies.
Well, there is a problem, but one of the things that is really going on, it's all about politics. What's going on in Washington is all about politics, because what we need to do is move forward. And if we get stuck in this, I don't see how the insurance companies can do it. I don't see how they can just all of a sudden say, fine, we're going to do this. Because they've all agreed with Covered California and signed contracts that they won't sell those policies. So there's a real disconnect here. I understand the president said something and he wants to cover himself. I can appreciate that, all right? Still, at the same time, I don't see how it's going to work. And I don't think California is going to accept it. I think they're going to be more like Washington. Oregon and Colorado are looking at the same thing. They have their own exchanges, and they're saying, no, I don't think we're going to do it. And I think what's going to happen is at the end of this week, they're going to say it's not really possible.
We have to close it there. David, Linda, thanks so much for coming on the program.
Thank you.
Thank you.